Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks to Joanne Rosen, Director of the Johns Hopkins Clinic for Public Health Law and Policy, about the COVID-19 vaccine. Their topic is the law of vaccine mandates. Let's listen.
Joanne Rosen, thanks so much for joining me.
You're welcome. It's a pleasure to be here, Stephanie.
So today we're going to talk about sort of the legal questions surrounding vaccination. And my first question is, once a COVID vaccine or vaccines are made available, could states mandate that people get them?
The short answer to the question is yes. States have the legal and constitutional authority to require that the people who live in that state be vaccinated or to introduce a vaccine mandate. And interestingly, the authority for the state being able to compel vaccination, the affirmation of that authority goes all the way back to a U.S. Supreme Court case in 1905 called Jacobson versus Massachusetts. And that case arose in the midst of an outbreak of smallpox in a town of Cambridge, Massachusetts. In 1902, there was a smallpox outbreak, and Cambridge introduced an ordinance requiring all adults to be vaccinated or revaccinated against smallpox. And if they didn't, they would have to pay a fine of $5. And Jacobson was a resident of Cambridge who, for a number of reasons, objected to the vaccination mandate and ended up bringing a lawsuit against Massachusetts for the mandate. And he raised a number of arguments, including arguments that his constitutionally protected liberty interest were being infringed by this mandate. And the Supreme Court in that case, and even though it's 115 years old, this continues to be the benchmark case on the state's power to mandate vaccination. The Supreme Court said that states have, under their police powers, which is part of the Constitution, they have the authority to enact reasonable regulations as necessary to protect public health, public safety, and the common good. And vaccination mandates constitute exactly that kind of permissible state action to protect the public's health. And further, I'm actually going to quote, I was looking at Jacobson this morning. It's old, but still quite relevant. In response to the argument about this individual liberty interest, the court said that sometimes individuals' interests might have to yield to state laws that endeavored to protect the health of everybody, the common good. The court said, this is a quote, "The rights of the individual may at times, under the pressure of great dangers, be subjected to such restraint to be enforced by reasonable regulations as the safety of the general public may demand." So yes, states can mandate that people be vaccinated. And once a COVID vaccine is available, states could elect to require that people who live within that state be vaccinated.
That quote feels very relevant today. It does not sound like it's that old.
Right. Yes.
Especially given the COVID pandemic. I wanted to ask you, so really, basically, in general, we all are vaccinated as children. That's when we can put most mandates on folks, right? You can't go to school unless you get vaccinated. Could the states mandate this in adults? I mean, I guess you're saying yes, but how might you enforce that?
Two very good questions. Yes, states could mandate that adults be vaccinated. By and large, it's children. Our immunization schedule begins as children, and we have to show proof of vaccination to go to school. So it is more complicated. It's a more complicated administrative matter to have a vaccine mandate that applies to adults. I should note that just the other day, this week, I think, the New York State Bar Association has a health committee, and their committee passed a resolution that the state of New York, should consider introducing a vaccine mandate once COVID-19 vaccines are available. And that would be everybody, children as well as adults. So the point you raise is a really good one. How do you go about implementing, enforcing, and ensuring compliance for adults? Because there isn't a point of common intersection with the state or with some agency of the state in the way that we have with children. So that will be, I don't have a clear idea of this, but that would be something that states would have to work into a mandate, because a requirement that people be vaccinated is only as effective as a way of ensuring that they are. And that also raises issues of the vaccine has to be available without charge, or in a way that allows people to get coverage for it for the cost if it's not covered by their insurance. But again, how are we able to keep track? The other advantage, or the other really important part that school-based proof of vaccination offers, is for people who have some medical reason to not be vaccinated. All vaccine mandates have included a medical exemption. People whose health would be imperiled because of an allergy to something in the vaccine, or because they're immunocompromised, or any other reason, they're exempt from a vaccine mandate. And when you go to school and you show your proof of vaccination certificate, or you show that you've been exempt and you're not vaccinated, it means that public health offices have a record of who is and who isn't vaccinated. And in the event of an outbreak of one of these vaccine preventable diseases, we can identify and isolate the people who haven't been vaccinated and are at obviously higher risk for being infected. So another question that states will have to consider and grapple with is, if there are exemptions to a vaccine mandate, medical exemptions for sure, but there could be religious exemptions or philosophical exemptions. We need a system of record keeping within our public health agencies so that the people who have been exempt can be identified and protected in the event that we have another outbreak.
Mm-hmm. So the goal, of course, of a vaccination campaign is to have as many people as possible vaccinated. And the exemptions that you spoke about would keep a number of people from becoming vaccinated. I know this was an issue in measles in recent years, that there were sort of too many of these religious or belief exemptions, and that's what caused outbreaks. Is that something we might be up against?
Yes, absolutely. And that's right. And I think probably most people can remember, because the measles outbreak in New York was about a year or two ago. And in California, I think it was traced to Disney World.
Disneyland, yeah.
In 2014 or 2015. And you're right that the reason for these outbreaks were in New York, it was religious exemptions. And in California, it was personal belief exemptions. And the legislatures of California and New York revoked their non-medical exemptions as a result, so that they could ensure they had higher rates of people immunized against measles. And guess what? The rate of measles immunization did go up when those exemptions were removed. The reason, to answer your question about these exemptions, one of the reasons that these exemptions, the non-medical exemptions, were introduced in the first place was to try to respond to and prevent vaccine-related backlash. There's a very strong culture in this country and others of personal autonomy and not wanting the government to force you to do something or tell you what to do, and people wanting to be able to make their own decisions about the risks they're willing to take. And we're seeing it play out now with respect to some people are wearing masks in order to keep themselves and others safe and be able to kind of resume some semblance of a normal life. And others either don't believe that masks keep us safer, or want to be able to make that decision for themselves and bristle at the idea of the government telling you what to do. And that's what's played out among some groups with respect to vaccine mandates. The introduction of these exemptions, in part, was kind of like a safety valve to let some of the pressure out of the system so that people could feel, they did feel that they had some choice and they could opt out using these personal belief exemptions if they wanted to. And so, although it seems counterintuitive, providing some opt-out mechanism, in fact, can protect the overall integrity and the legitimacy of the vaccine regime and public health, because people may not feel that everyone is being forced to become vaccinated. There could be sort of lobby groups against it. So yes, the goal of public health is to ensure that as many people as possible are vaccinated to prevent the transmission, the further transmission of disease, but it leaves the question about, okay, how best do we achieve that goal? And a vaccine mandate looks like it's the most straightforward way to do it. But if we have a lot of backlash and resistance to it, how do we then bring those folks on side? And so it might be that one approach is to start with a strong recommendation, education campaign. Physicians, healthcare providers can be part of this, but you educate people about the safety of vaccines. And I think a particular issue that we may face with a COVID-19 vaccine that does arise with other vaccines, but not to the same degree, are questions about, but is it safe? Because it's brand new. So measles, mumps, rubella, polio, smallpox, they have been around for decades, if not like even longer than that. And while there are concerns in small pockets about their safety, they are regarded as safe, and we have decades of data. But COVID-19 vaccines are going to be brand new. And so there will probably, I think, or I wouldn't be surprised if there were more concerns, even among people who themselves are fully vaccinated against other diseases and who have vaccinated their children. There may be more concern about these brand new vaccines, and are they really safe? So one approach perhaps to start is strong recommendation, being transparent, as these drug companies are doing their best to do, about what they know and about safety. And then once the vaccines are available, states can make it as easy as possible to get vaccinated. And even in the absence of a mandate, can, when you're vaccinated, there's public records kept. They can see, look, what percentage of our residents have in fact been vaccinated, have elected to be vaccinated. And if the percentage is high enough to ensure that the whole community is protected, there wouldn't be a need for a mandate. So one way to start, you could have a mandate. You could start by strongly encouraging, getting the word out about the safety, making it easy and accessible, and then taking stock to see what percentage of each state's population is vaccinated before determining whether sort of stronger measures such as a mandate would be required.
Mm-hmm. You bring up some really great points. Now, one thing that you and I both know is that private employers can mandate a vaccine. For example, you and I both work at Johns Hopkins, where we must get a flu vaccine.
Yes.
No decision, of course, has been made on a COVID vaccine because it doesn't actually exist yet. But private employers can play a role here.
Yes, they can, and they have. You gave the example of our private employer. It's very common in particular sectors where the employer has to have a reason. It has to be a reasonable basis. If you worked at, I don't know, the Gap or something, I'm not sure that the Gap as a corporate entity could require all of its, they may want them to, and they may recommend it, but it wouldn't be reasonably related to the requirements of their job. But you're right, employers, particularly in sectors in which the employees are themselves at greater risk of contracting some of these vaccine preventable illnesses, or work with populations that are especially vulnerable if they do get sick. So hospital workers and healthcare workers more generally, people who work in facilities for seniors. Private employers have required that their staff are vaccinated, for example, against the flu each year. Another thing states could do, short of an across-the-board requirement that everybody be vaccinated, is they could begin with a mandate that focuses on the same kind of sectors that you and I were just discussing, people who are themselves at greater risk or who work in proximity with vulnerable populations. And we don't want the employees themselves getting sick or being a bridge or vector to infecting others who are vulnerable. But yes, employers, and that will, it may be another area of potential challenge if there are employers who require COVID vaccination because of concerns potentially about safety. There have been some cases, one I remember reading about years ago, in which a nurse in a hospital refused to be vaccinated for the flu and ended up filing a grievance against the employer. So people may object, but we will wait and see. But I did want to flag that sort of some more targeted form of vaccine mandate is also would also make sense and would also be possible.
Well, Joanne Rosen, thank you so much. You've really given us a different perspective on this.
Oh, my pleasure. Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.